Hello, my name is Dr. Caroline Reid O'Connor and I'm a Specialist Registrar, dual training in medical psychotherapy and general adult psychiatry. Today I'd like to speak for a few minutes on anxiety disorders. Anxiety is a very common natural human emotion. We all experience it from time to time. We might feel a sense of anxiety or apprehension, or we might get caught up in worrying thoughts or become preoccupied by a particular fear. We might experience bodily sensations like our heart beating fast or butterflies in our stomach. But although anxiety is a normal natural human emotion, sometimes for people it becomes more intense or more pervasive and it starts to cause them problems in their everyday life. And in that situation we might diagnose an anxiety disorder. So I'd like to speak briefly about the most common anxiety disorders we see and the treatment strategies that we use to treat them. First of all, we have the phobic anxiety disorders. Somebody might have social phobia, for example, where they struggle to be around small groups of people, or agoraphobia, where they struggle to be outdoors or in public or crowded places. Or they may have a very specific phobia, for example, to heights or spiders. Then we have panic disorder, which is where people experience intermittent attacks of intense anxiety or panic attacks. And these aren't usually linked to any particular situation, but can in fact just come out of the blue. Then there is the more generalised anxiety disorder, where somebody feels a sense of pervasive worry and tension every day over a longer period of time, say 6 months or more. So these are some of the most common anxiety disorders we come across. In terms of treatment strategies, we have two main strategies: medication and talking therapies or psychotherapy. Starting with medication, we use sometimes anti-anxiety medications like the benzodiazepines, although we only tend to use these for a short period of time because of their addictive potential. More often we'll use medications like the antidepressants, which have been shown to be very effective in treating anxiety over the longer term. In terms of talking therapy in the NHS today, we often use CBT or cognitive behavioural therapy to treat anxiety problems. And we've found that generally speaking, a combination of both medication and talking therapies together is the most effective in treating anxiety disorders. So in summary, anxiety is a very normal, common human emotion that we all experience, but for some people it goes on to cause more problems in their lives and we might diagnose an anxiety disorder. But the good news is that there are lots of effective treatments for these and that the majority of people suffering from these problems do respond to treatment and do very well. Thank you.